Awesome, fantastic. So welcome everybody, and all of those of you who are watching this. On behalf of myself, Sarah Haboubi, and Health Freedom Ireland, a huge welcome to everyone who's logged on, and of course a massive welcome to our amazing panel. Not everybody is here yet, but we will have a fourth member joining us shortly. And I just want to say how excited I am about this next 90 minutes. For me personally, this has been a very fascinating, worrying, exciting journey since March. I think like most people, I call it well, I don't call it, but I heard it being called the Corona coaster. And some days we're up and some days we're down. And it was really through the amazing panelists, as well as probably about a dozen others, that my own journey started to take a very, very different turn. And it was a much more positive turn, really, at the end of the day, and out of fear and into hope, really, and also into a little bit more certainty and understanding of what was actually going on. I read a statistic today that was quite scary, which was that 85% of small businesses have scaled back massively, have looking to close, or have actually completely shut their doors for the last time, that they are not opening. And to decimate the high street and our city centres like this is really, you know, I just think it's criminal, and we really need to do something about it. So the audience today, the aim is to really help people to understand things from a different perspective, one that hasn't been shared as widely across mainstream media or from the government. It really is a very different narrative, and one that, as I said, is designed to give hope and to lift people's spirits and to give people some ammunition, so that they can feel they can open safely, that if they are going to open their doors, they're not going to harm anybody, themselves, their staff, their customers, or the wider community, and also to look to take some action with their local representatives as well. So we'll get into that. I saw a great expression, which was, or a great quote, which said, you know, we're not all in the same boat. We might be in the same storm, but we are definitely not all in the same boat. And you know, this thing of we're all in this together is just simply not true. It really isn't. And you know, the idea is to unite people, to help communities, you know, rural and urban, to actually unite together, to support businesses when they open, to make sure that they survive, you know, post this particular lockdown and as we go forward. So the panel is incredible. I'm so excited. I've watched hours and hours of our first speaker, Mr. Ivor Cummins. He was the one that really opened my eyes to the whole stats and how they were being, you know, quite misleading at the end of the day. And Ivor has an incredible background. And I was going to introduce each person, but I really think it's always better coming from the individual, to be honest. So Ivor, we're going to go over to you. Tell us a little bit about yourself, your background, and really your own journey, maybe as you started through this, like the rest of us.
Yeah, okay, thanks, Sarah. So I'm a biochemical engineer, and I've spent, well, over 25 years in complex problem solving, team leadership, managing teams, worldwide problems, the most complex ones you can get, multi-factor, for what it's worth. So I'm top of my field, I would say, without being arrogant. So around 8 years ago, I got involved in metabolic health research, preventing heart disease, preventing diabetes, speaking at nutrition medical conferences all over the world. So I did around 6 years of that, or 7 years. And then Corona came along in March. And I knew from the Diamond Princess data and from even the Chinese data, I was able to reassure my wife and that, who was worried about it. Look, it's going to be tough flu equivalent, really tough, especially on the aged, but we don't personally need to worry about it as it happens. And but then the lockdown happened, and I kind of understood that because Imperial College had the disastrous 12 times wrong modeling. And given that was given to the government and the panic, I could understand the lockdown. But then, of course, in April, May, I knew it would curl over. Influenza, seasonal curve, come back next winter in a smaller way. And I thought by May, this is going to run out, and it didn't. And now here we are, right? Inexplicably, here we are. So that's it. I've been 7 days a week on it since March, April. I interviewed professors, doctors all over the world and put out a lot of factual data and hopefully help people understand it. So I have some slides, actually, will probably help what I go through today.
Go for it. And just want to say a quick hello to Dolores, and delighted now.
Hey, Dolores.
be hearing from her shortly. Yeah, go for it, Ivor. Let's see some of your amazing data analysis and how you've distilled this down.
Okay, doke. Thanks, Sarah. So does that come up there, WHO? Great.
Yeah.
So WHO, it's important for people to realize, especially business people, that a century of pandemic management, science and technology culminated in the WHO October 2019 guidelines. And it was influenza focused, but we know this is similar family and same dynamics, maybe a little more spreadable. So anyway, they said no contact tracing recommended once a virus has entered the country largely, because the virus is over the horizon before you even begin to track. They knew that. And no quarantine of exposed individuals. They didn't even cover quarantining whole countries because in October 19, that'd be too absurd to discuss. I mean, who would even think of it? So we leveraged China for some reason in February, March, and here we are. But important to know that this document is still online, it's official, but they changed their mind. So I'll have to use next here, excuse me.
When did they change their mind? Do we have a kind of timeline of when they went to this?
Well, when Italy happened, you know, even though 80 or 98.6 were one or more comorbidities and very advanced age involved, there was a panic over Italy because of the sharpness of the curve. And then the WHO, I think around then, began to talk positively about lockdowns, and they began to talk about China's approach, and that was successful. I think from memory, that was it. I thought it was bizarre, but anyway, ever since they've beat the drum for lockdowns. I mean, Tedros a couple of weeks ago after Nabarro came out and said, we don't recommend lockdowns unless your hospitals are overwhelmed. Then Tedros came out the next day and said, if you don't lock down, guys, you're going to have huge death in Europe. So look, it's just chaos.
It is chaos. So what are we looking at here?
So here, I put this out on the website. I've been sharing it a lot. We have 22 papers now and analyses, including one in Lancet, right? And Bristol University and others. And they all have done the analysis on the actual mortality data. So the modeling was complete pie in the sky. We know that now. But now we have loads of science on analyzing lockdown effect on all-cause mortality, mortality per million in a country, any country. And there's no correlation. So there's no linkage. So the science is in. So the 22 papers there you can download. And I also put a sample only of the damages of lockdown. So the cost benefit of lockdown is probably one of the worst cost benefit returns possibly in history, probably in history. So I'd say it'll cause 10 to 100 times more suffering and death than the COVID savings, if they exist.
And do we have any evidence at all that that this cost-benefit analysis was done beforehand? A risk analysis was done?
No, not that I'm aware of. And ONS came out back in, I think it was May or June, and they said approximately maybe 185,000 extra deaths because of lockdown. And, you know, their assumptions now would be much worse because we're into this madness again. So that's the kind of numbers. The savings, 50K maybe in UK died. The savings and deaths arguably are in the noise. So the cost benefit, but I haven't really seen any I've seen put millions of dollars per quality adjusted life saved. You know, it just makes no sense.
Right. Yeah. Okay.
So
yeah, very, very strange.
I'm going to do a couple of minutes in Sweden and then I'll go back to Ireland, all-cause mortality. But Sweden is very important, as many people may be aware. So if you correct for demographics, their increase in aged over the last few years and a few other factors, they essentially perform the same as Ireland. You can see here the all-cause or deaths per million people for COVID, and Sweden's there in the green. And it's not quite up to date now, but Sweden has humped up a bit and it's back down again, and Ireland's languishing. So we see the classic case of new virus comes in, it's like a skipping stone, mostly. The first wave is big because of immunonaivety, and even that is not everyone. And then the second winter seasonal resurgence is naturally smaller for multiple reasons. And then after this season coming, it's going to kind of go down to some little bumps, I would say. And so this is where we are.
Can I just ask, because this was the thing that blew my mind when I first saw your podcast. I can't think which was the first one that you did about all-cause deaths. And it was such a revelation to me about how we've got these COVID deaths, and they're always being announced, and you know, every single day we have our numbers, and you know, obviously, I mean, I was like everybody else, I think, in terms of at the beginning, you know, glued to the 6 o'clock news to see, you know, how many today, and to wait for that, you know, because my husband was also tracking this and saying it's going to go over. He said, if you look at every other country that we're behind, it's going to reach a peak, and then it's going to go, and then we're going to be into the decline of this. And it was only when I saw your all-cause deaths graphs that it suddenly just everything had a completely different perspective, because it showed that actually we're not really far off from a typical year. Is that true?
Well, for most countries, yes, it's not going to be an unusual year, but it'll be a very unusual March, April in Europe generally. And the countries that didn't really experience a first wave, you know, they're kind of getting their first wave now, like maybe Czech Republic and that. And then some are getting 2 substantial waves, like Italy got a big first one. Now it's getting a pretty big second one, but that's to do with population health dynamics. So, you know, this thing is just not what's being said, but I'll show the all cause in a moment, and it's interesting for sure. So here's Sweden behaviors. As we know, they did not lock down. CNN went in May the 6th in their epidemic. Older lady getting haircut, no masks, kids up to 16 in school. People keep a meter distance, stay at home if you're sick, use hygiene. They followed the WHO October 2019 guidelines. Everyone thinks they did something unusual. It's not true. They followed the time-honored pandemic guidelines. It was everyone else who did something weird. So we've got to keep that in mind. And what have they been doing the past few months? Well, I have people in Sweden. Here's photos sent to me. Right?
I'm jealous.
This is it. Public transport, no masks. Everyone in stores. Right? That's the reality. But as you can see, they're the same as Ireland, rough and tough. That's because there's 22 scientific papers that show you don't move the mortality needle with lockdowns. It's intuitive that you should, but you don't. Right? It's more complex than that. So there you have it. And here's Sweden, a few chosen years, and this is mortality per week per 1 million population. So you get a hump in November, December, January generally because it's the flu season, right? That's fair enough. And if we look at 2020, you know, it's technically lower. And if we take another look, here's corrected for the aged demographics, population age corrected mortality. 19 was the soft year, and that will of course build up frail elderly to make 20 worse. And yeah, but even then, not particularly notable. And I'll just show a longer historical perspective. Spanish flu back here obviously was a once in a century event. This was cholera, I think. So there's Spanish flu. And then if we look at more recent years, we've got various flus that show, you know, significant enough spikes. No one did anything. And then we have COVID, which hit in April.
Gosh.
That's the reality. And no one can deny this because this is data from the Swedish government database, and they did not lock down clearly. And it's undeniable. COVID is not particularly special. It's special in terms of it hit in a very short period with a sharp spike at the end of the winter. And the 2020 respiratory season for winter right up to March was extremely low. In fact, in Europe, there was no excess mortality. It was bizarre. So of course, when Corona triggered in March, April, it was a very short, sharp spike. And that was one of the things. But that's reality on one sheet. And here's Sweden now. Exactly what we said back in May. Nothing will happen all summer. Same in Ireland. And a winter resurgence, because in the 6 months here, you'll have frail elderly that have gotten in 6 months massively more frail elderly. So there will be a susceptible population in the next winter resurgence, and that's what we're seeing. But Sweden is curling over in cases now. You can see ICU here is leveling off, and mortality, maybe with some lag, is kind of leveling off. So exactly what we predicted. There'll be a lesser but possibly substantial bump in the winter, and there'll be nothing all summer because coronaviruses are sharply seasonal, especially in Europe.
Someone has just asked, you know, what would the effects have been if we hadn't locked down? And I think this is why you're showing Sweden, because Sweden didn't lock down. They didn't have a hard lockdown. People took their own risk assessment, did their own risk assessment, and decided for themselves, by the looks of it, whether they were going to go out or not. I know I saw a video showing a lot of elderly people had decided to, stay home and not be out and about as much, but everybody, so it was not like we have here. So we can see that without those hard measures, Sweden followed pretty much the same path as every year.
Yeah, and I mean Belarus as well. I mean, people say, "Oh, Belarus dictatorship," but the reality is we've got their all-cause mortality now, and there is a spike in the affected months, but they did no lockdown at all, essentially. And again, similar kind of experience. But again, there's 22 published papers on this, so we can look at the observational data like we are doing and see there's no correlation across the world. Or we can look at the published studies that have done the full detailed scientific analysis, but it's the same answer, essentially. So if we go back where we were then, I'll just be real quick here. Here's Sweden all-cause mortality, the latest data from Joel Smalley in the UK, an analyst, and he's amazing stuff in the UK. But here we are up to date, and the green line is all causes. Might be a slight lag, but you can say massively within the two error bars for prior 5 years. And here's the corona spike. But note as well, the error bars for prior years can get quite high months as well, right? So this is just not what people think it is.
Yeah.
And
it's
I'm going,
isn't it?
Yeah, I'm going to actually, Sarah, skip through this, but people wonder about the Nordics. And the thing is, the biggest reason Sweden was different than the Nordics is their mortality was extremely low for the last 18 months before Corona. And then they got the kind of compensating spike. And the UK is similar. Ireland actually was similar. But if you look at the Nordics, they didn't have those dynamics. So the biggest reason for a country's mortality, actual impact, generally is this kind of effect: how many old, frail, elderly, or metabolic health problems there are, generally speaking. And the reality is that's the difference with the Nordics. There are published papers on this phenomenon, multiple ones. You can see Sweden there has a massive stock per million of dry tinder, is the term they use for frail elderly.
Horrible phrase, isn't it? But
it is. The only reason the reason I use it is because it is in the published scientific papers, and I tend to try and reflect them. But yeah, people don't like the term. I use frail elderly, as you've seen, and there's mortality per million. So this is published.
There's a big difference either, though, isn't there, between someone who is frail, fragile, and someone who, this whole thing about being vulnerable.
Well, you can be vulnerable.
There's a lot of people think, oh, and I'm going to address this as well to Dr. Morrissey and to Professor Cahill as well, but just in terms of, people go, well, I'm vulnerable, and it's like, well, actually, if you look at the stats and the actual age bracket and the types of underlying health conditions, it's not everybody who has asthma or who, those sorts of things.
Yeah, I mean, what I'd say is over 65 or 70 for substantial risk, over 65 or 70, and with diabetes type 2, or serious inflammatory conditions or later stage cancers, or very elderly and frail. I mean, rough and tough. We know who it is. We could have easily sheltered them. That's what Professor Beda Stadler.
This is what today is about, this webinar is about as well, because we're talking to the working population. We're talking to those, under retirement age, who are running businesses or who have staff. So it's about, really making sure that everyone under 65, understands, for them, the risks are so much smaller than when you do go above that age gap. And it is quite a unique thing, isn't it, about this particular virus, by the looks of it, that it is so age specific.
Yeah, I mean, it's less bad than a severe flu for the younger people and pregnant women, which is we can be thankful for. And it's worse for the elderly and people with severe conditions. And that's just the way it is. So blame the virus. The only thing we can blame people for in this is lockdowns, which are going to cause vastly more suffering and death, cancer, heart attacks, suicides, with enormous quality adjusted life years lost compared to Corona, which on average loses a few months because the average age is ahead of the life expectancy. And this is the problem. What the people have done is caused enormous suffering and death. and not the virus. The virus did its own thing. We made it vastly worse. And if you look here at Ireland all-cause mortality first 5 months of the year, which encapsulated our epidemic. We all saw all the newspaper articles, the death counts. It's no different than the prior 5 years. As I said, we had a soft 19, which would have made this worse, but still April in 2020, the peak, is no worse than January in 2017 or 2018. This is the actual picture of the epidemic, only no one knows about it.
And I always said, if you took the dates off and you said to somebody, which year was the pandemic?
Yeah, you wouldn't know, but the clever clogs would know.
You wouldn't even pick 2020.
No, you wouldn't, except if you knew it was April instead of January, but it's the same numbers.
Yeah.
So that's just a reality. And we see this all across Europe pretty much, including Sweden, I showed you. Again, it wasn't lockdown that did this because we have all the science in now and analysis. So it wasn't lockdown that kept it lower. Some people believe that myth. Yeah. And if you look at Ireland as well, and this is quite shocking, this came out RTE in May, and I've been putting this out for months. Here's the actual deaths per million, very substantial, hit a peak. But the reality is 95% of the people who died were too aged or close to the door already, independent of COVID, to be given ICU. I mean, it's just an ethical decision. It's nothing wrong. And if you take away the 95% for a moment, I know all lives are precious, but you've got to have perspective. Then you had this. So the 5% who are not in that no ICU reasonable state, you've got less than one death per million people in Ireland per day at the peak of the epidemic, the peak. After that, it's flatline. So yeah. That's the reality.
And we had opened up in the summer as well, a bit more, not completely. And, you would have, and there were protests and all kinds of things. So, none of that caused any spikes, did it?
No. And we brought in, I would say, it possibly wins the prize for the most anti-scientific thing I have witnessed in my lifetime, was to bring in mandatory masks in the middle of a summer for a clearly, 100% clearly seasonal influenza type illness. Because if you bring in mandatory masks in the middle of the summer, it's going to be flat. Nothing's happening and nothing will happen until around October. You know that.
Yeah.
And you bring in mandatory masks. There is no exit strategy.
Absolutely. My 14-year-old said to me, he said, hang on a minute. He said, why were we not told to wear masks in March, but we're being told to wear masks now, and very few people are dying? He's 14.
Yeah.
He got it more than most adults. He just said, this doesn't make any sense.
Yeah, and I'll tell you, there's other people. I know a management accountant who copped this on in April, or maybe in early May, and he rang me up and he asked me, Ivor, he said, is this thing bullshit? And I said, what do you mean? Have you been listening to my podcast? He said, no. He never listens to technical things. And I said, how did you work it out then? I was genuinely curious. And he realized a couple of things. He realized he didn't know anyone who knew anyone who died, except for one person in a care home maybe, or even really got sick. And he said, where is the epidemic? And I said, in the media, and being smart. And then I said, but what about the lockdown and all this stuff then? And he says, well, I've gone to all the stores because I like shopping, and most of them are closed, but I've gone to all the Aldi's, Lidl's, everything. And I started quizzing the older people working there, and no one got sick. No one died. And they're not locked down. They've no masks. They're indoors, and all the great unwashed are coming in and out every day. And I said, you're actually correct. We see it in the UK. We see it in America, 4 million grocery workers. The non-lockdown people, we saw it in New York with Cuomo. The non-lockdown people, there was no signal. So it wasn't the lockdown. So listen, I could go on all day, but business people
we have some other speakers. So I will have to, unfortunately, I can speak to you all day as well, Ivor. It's such an honor to have you here. As I said, I've been avidly following you since I don't even know where your first podcast popped up, somewhere on social media, somewhere. And I just was delighted, and I was sharing it around to everybody, and got my husband to watch it. And luckily I've been, him and I are on the same page, but I know that's not the case in a lot of households, even amongst families, you know, there's a lot of division, and we've all got to unite, and it's got to be united on facts and figures, not on superstition and not on, you know, a wing and a prayer. And your facts and figures certainly helped me to you know, kind of understand what was really going on. And as you said, the Diamond Princess, I was also had heard a Michael Levitt interview, and he was saying exactly the same thing, and had been ignored. So Ivor, thank you very much. Hang on though, because there's a few questions, so if you don't mind, we'll come back to those at the end. So we're going to move on to our next speaker, who is Dr. Pat Morrissey. He's a GP over in Limerick in Adair, and he's a remarkable GP because he didn't behave like most other GPs. So I'm going to hand over to you, Pat, and you can explain your sort of journey through this as well, and some of the things that you did differently.
Okay, thanks, Sarah. Well, Ivor has given you the helicopter or the satellite view of what's been going on here, and I'm rooting around in the dirt here on planet Earth, dealing with patients, and I'll give you my perspective, but it really backs up what Ivor's been saying. I'll just give you a bit of perspective on who and what I am. I'm a GP working in a 2-doctor practice. We have about 3,500 patients in semi-rural County Limerick. And as you've already mentioned, Sarah, I got into a bit of trouble for my outspoken views regarding the lockdown measures and the manipulation of data, as I perceive the manipulation of data that has led us to having this depressing culture of fear in the country. And at the same time, I spoke out about treatments and more positive things that we could focus on, such as early outpatient use of hydroxychloroquine and zinc, and the widespread use and emphasis on vitamin D, which has been shown in many studies to reduce both infection and mortality with COVID. And even as recently as last week, there was a TD in the Dáil raising this issue and why wasn't it being promoted. And our great government were saying that there isn't any or sufficient evidence to promote vitamin D in relation to COVID. It's just staggering.
But I personally have seen papers from peer-reviewed papers in medical journals around the world that have even early on, I think even in April, it became very obvious that when they looked at the data from Italy, the vitamin D deficiency had a massive correlation to mortality. Is that right?
That's true. And actually, there's one very good Irish study. I can't remember the name on it, but it's easily searched. If you look up Ireland vitamin D study, vitamin D by country, you can see how the countries that fared worse have lower population vitamin D levels. So it's interesting even to look at that as one single indicator for severity of COVID. And what Ivor has mentioned, there's lots of other factors in terms of demographics and age and you know, multi-generational households and lots of other factors. But vitamin D is a very powerful indicator for the susceptibility to COVID.
I'm assuming, you know, I mean, I take vitamin D, I take 1,000 whatever it is, micrograms, milligrams, that it is. And is that enough? Is that what you would kind of recommend to people?
Well, it was a very good study from Israel about 2 months ago, and it showed that the liquid formulations are actually the most effective. And the hypothesis here is that you're actually coating your upper respiratory tract and digestive tract with, you're bathing it with vitamin D, and this is their hypothesis. So you're actually getting even higher levels high up in your throat, and that from the liquid formulations. But any vitamin D is better than no vitamin D. And whenever you're going to your GP, you know, make sure you have your levels checked. It's a simple, cheap test. And it can give you some.
Someone's just put a comment there which says that actually typically Ireland is fairly well known for having vitamin D deficiency.
Yes,
across the population, and obviously we don't have a lot of sunshine.
To
help with that. Yes,
Ivor. I might just, one thing, Pat, just occurs to me. I was giving a talk yesterday, and people know Italy got hit hard and Japan doesn't. But just as an example, one study in elderly Japanese women, their blood level 95% of them were above 30 nanogram, which is healthy metabolism. And in Italy, study on elderly women saw 75% of them below 12, which is catastrophic. So it just shows you the kinds of massive differences around the world and how they could link to this.
Yeah.
And it is so important to see those differences, because when you just compare, you know, deaths per million across the world, you're not taking into account all the other factors that actually, you know, we're all human beings and we all function differently. And depending on the environment, it's going to have a huge impact. It has to at the end of the day. So Pat, go on. So HCQ, which of course was ridiculed because certain president was advocating.
He yes, Donald tends to polarize everything he touches, but it's a very unscientific stance to rule out what he says just because he says it, you know. And I would go away and do your own fact finding and research. Actually, fact finding has become a dirty word lately when you see what's going on in the internet, but I'll leave that. But just coming back to my own situation, I was also involved in setting up the first COVID community hub in the Midwest in South Hill, and I was dealing with patients there. So I have come across upwards of 200 patients with COVID. Many of them, in my own practice, many of them were just over the phone. In the hub, they would have been a slightly sicker cohort, and about 20% of the people that I saw in the hub, we would have to send on to hospital. They were further along in their illness, and they were coming from a wide geographical area. But in my own practice, I only had to treat less than 10 people with hydroxychloroquine and zinc. And I am an outlier among my colleagues, and many of my colleagues would not use hydroxychloroquine or zinc.
And why wouldn't they though? I mean, because obviously, from what I understand, it's a very well used drug. It's very, it's been 75 years. Is that about right?
Yes.
Something like that.
Yeah, 70 years.
Well researched, it's well documented, and I understand it's even safer than ibuprofen.
Yeah, it's safe in pregnant women. Yeah, it's very, very safe, and it's sold over the counter in many parts of the world. And it's part of the reason why they postulate that India and large parts of sub-Saharan Africa have such low COVID mortality. But as well, South Korea and Japan, very low levels too. But I've lost my train of thought there. Oh yes, a lot. It's been misrepresented. It's all about timing. When you get COVID, there's a flu-like period. You have a fever and you have a bit of a sore throat and you're achy and you have a cough perhaps. And then about day 7 to day 10, you can deteriorate. Your immune system gets ramped up, and you begin to go through this cytokine storm. And then the breathlessness can become very excessive. You can start to develop these thrombi, this vasculitis, where you get little clots forming around your body, which can be quite serious. But there's ample time there before you become very ill to intervene. Before you get sick at all, take your vitamin D, sleep well at night, get plenty of exercise, have a laugh, meet up with your friends. But if you do get COVID, there are things that can be done. You can talk to your GP. There's plenty that can be done, and it's only a very small minority. Just to reassure people, John Ioannidis, who's foremost epidemiologist in the world, he's in Stanford in California, says that and these figures have been backed up from other sources as well now, that the overall mortality overall all ages, it's 0.23%. Okay, so that's less than 1 in 400 folks will die from COVID if they get COVID. And that isn't even taken into account the fact that many people are not even susceptible to COVID. It's increasingly shown that upwards of 50% of the population aren't even susceptible to COVID. And
I think that was at the start though, wasn't it? That was actually, they reckon right at the beginning of this, we could have had some T-cell immunity.
Yeah, this is why the models were so wrong, because they thought everybody was susceptible. And we know now that's not the case. This study's been done on blood in blood banks both in the UK and the United States that shows that the retained blood is resistant to COVID. Blood from 2015 up to 2018. How did that happen? You know, and this science is being ignored. But in any case, I'd just like to go on. Ivor talked about the cost-benefit analysis, and this is what provoked me to get involved in the public debate, because I saw in my own practice how the lockdown was having negative effects. And just anecdotally, I had one case of a suicide in somebody whose cancer treatment was cancelled due to the lockdown. I had one case of a fatal MI, fatal heart attack, in somebody who'd been referred pre-lockdown and in normal circumstances would have been worked up and assessed and had their angiogram and their intervention if required, died during the lockdown. And I've had, in relation to mental health issues, I've had alcoholics and people with addiction issues. I'm thinking of one case in particular. His life is fallen apart. His physical health has deteriorated so much that he's now going into a nursing home. And even just in those three cases, Ivor mentioned the quality adjusted life years, or years of life lost. Those three individuals, it's in excess of 60 years of life lost. Okay, and I haven't had one COVID death in my practice, not one confirmed COVID death. And I
wonder how many GPs actually have had confirmed COVID deaths, like just purely, from that.
Well, on the odds, I should have had one or two, but I've treated the at-risk patients that I had. I treated early. Okay, so I think I've probably done my patients some good. I look after patients in 3 nursing homes. I have about 70 nursing home patients. There's been no outbreaks, thank God, touch wood, in any of those centres yet, and hopefully there won't be. But I have them all on high dose vitamin D, and they're using their protocols. But I haven't seen, if this was such a terrible pandemic, why are not people dying left, right, and centre? And we were all afraid back in March and April.
Well, we saw those videos of supposedly people dropping dead in the street in China.
Yeah.
I mean, when I watch those back now, you can see the guy breaks his fall, which is a pretty clever thing for someone who's just dropped dead to do. So, we do have to wonder, the messaging, was, and we just believed it. Everyone was in a panic. Sorry,
Ivor wants to come in.
I might just come in again on the quality adjusted life years that Pat mentioned, and people need to get this in their heads. And there's business people here, should be good with some numbers, right? And these are easy numbers. So if you take the suicides, there were 3 triple suicides in the newspapers, but the vast majority we never hear about for a year or two. I know anecdotally directly of several, right? And they were lockdown induced. And some of those people have heard of others. And that's just within a very limited network, right? So if you had, let's say 800 HICWA said probably deaths, average age around 80 something for COVID, okay? And you're probably talking a few months of lost life each, but let's say half a year average. That'd be very generous. That's 400 life years, right? Now, for someone middle-aged or younger, you only need around 20 extra suicides to match COVID life years lost. That's just suicides from lockdown can beat or exceed COVID life years lost. Now, suicides are smaller than the heart attacks, right? And the cancer deaths in the coming years. So that's where the cost benefit, it's cut and dried that lockdown will drive vastly more suffering and death, right? That's a given.
It is.
And yet look at the way they cheerlead on lockdowns and they say, oh, you don't care about granny. But I would turn around and say, these people who push lockdowns, they don't care about anyone.
Yeah.
And so many are so lonely and they're locked away now. They haven't. I just read a horrible tweet today. Someone some woman who was 85 hadn't had a hug since March from her family. How is that how, you know, stress and loneliness and isolation, you know, they are killers too.
Yeah.
Pat, we're going to come back to you if that's okay, but I know, Professor Cahill is under pressure. She's very kindly kind of tuned in here. So Professor Dolores Cahill, if you're there, you can maybe put your camera and your video, unmute yourself. She'll come in a minute. I'm sure she maybe got stuck on a call or something. But Pat, I mean, I think that the bottom line is that there is a very effective treatment that can be used within the community. I mean, I think that is the bottom line. This is not a death sentence. If someone has a test, and I'm going to ask Dolores this in a minute about the PCR tests, but the people that you're talking about, the cases actually had symptoms.
Yes.
I'm just on.
Hi, Professor Cahill, how are you?
Yes, Dolores, hello everyone. And hi, Pat, hi, Ivor, hi, Martin. Hi, it's lovely to see you all.
It's fantastic to have you here. Dolores, I'm going to let you introduce yourself because your resume is it's incredible.
Oh no, I'll keep it short. I'll keep it short. Molecular biologist, immunologist. I spent 20 years running a company, and I really woke up in 1995, 6, 7 when I developed and patented, which was granted worldwide, high content protein array technology that was able to determine if diagnostic tests were actually against what they were supposed to be, or antibodies used in research in diagnostic labs in pathology was actually, and you know, nearly all of them were incorrect. So I went about correcting the record, and I got huge resistance. And at the time we were leading the Human Genome Project in Europe. So, and I was on very early the government advisory science councils across the world and in Germany as a 20-year-old postdoc. And we, with Hans Lerach and the Max Planck, got funding to set up 40 people for 10 years in the resource center of the Human Genome Project. And we made all of our tools, and I made my protein arrays available so that everyone in the world could assess my results, which they did. They were distributed freely. But that started me on my journey around research integrity, and as an editor of journals and speaking with, you know, I've been on Nobel Prize nominating committees and Nobel Prize winners. It's well accepted in science and medicine. About 80% of the papers are not reproducible. And so that's why I've been awake really from 1999. I've been involved in vaccines. We were able to make safe vaccines, would have been. And that research, you know, I got huge pushback, you know, about how my career would not be career enhanced if I kept going on about research integrity. So I've been very aware about diagnostic tests, diagnostic assays, and I was totally awake in SARS, the first SARS in 2002-3, that the real death rate was 774 people in the whole world. So your chance of dying was 1 in 8 million. The WHO, still on their website, has a mortality of 10%. So that's how I knew way before this SARS-2 that how they were reporting it, how they present the results was incorrect. And in 2003 and 2005, they had clinical trials of hydroxychloroquine that were shown to work in coronaviruses. So there was absolutely, from day one, no need. And Nobel Prize winner Michael Levitt studied it in January. So there was no need for this lockdown ever.
Absolutely. And so speaking of assays, the PCR test, can you shed a little bit of light on what it is, what it can and cannot do, and why has it been used as the main diagnostic tool here? Can you help us to understand that?
So I guess I can, but I think what I always go back to is that so you only have the PCR test if you need to determine, you know, whether this thing is there. But actually, there was no need from day one. So when the World Health Organization declared the pandemic, okay, at the end of this season of flu season, it was 4,291 people died between December, January, February, March, right? Which was only 1% of the annual flu season. So you had a chance of 1 in 1.8 million people of dying, okay? And there was prevention and treatment. So that means there's no need for the lockdown, no need of quarantine, but also no need for social distancing, no need for PCR tests, okay? So the PCR test is a bit of how the distraction works, because the World Health Organization has been calling pandemics incorrectly, like avian flu and swine flu and SARS-1. So in a way, how this magic trick, emperor has no clothes, only works if you start talking about cases done by PCR tests. But the real thing is, no one need die if you give them prevention and treatment. There was no need for the lockdown. And actually the PCR tests are actually a waste of taxpayers' money, you know, that the health systems across the world should not be doing them. They're not necessary because no one need die from COVID-19. You know what I mean? So talking about them is adding to the distraction of cases and PCR. It's last year's flu. It's like testing people for chickenpox, you know? It's last year's flu, it's finished, it's seasonal. After May, people are not dying of coronavirus.
And Ivor Cummins used the term case-demic.
And I agree, I admire Ivor, you know, he's a real hero. So the thing is, I suppose we have to call it, right? They called, the World Health Organization incorrectly declared a pandemic on the 11th of March, when we say 400,000 people die every year. When they declared it, they named coronavirus as the causative agent of the disease COVID-19. Anyone would say, how many people have died in this flu season? 1% of what normally you would have. It's prevented, and it had treatment available, which was well known from 17 years ago. So therefore, the pandemic declaration at 1% of the annual flu was incorrect. And therefore, we have to hold people to account, because politicians, you know, whether it's Leo Varadkar or Boris Johnson and everyone, they just have to say, wait a minute, it's 1% of the annual flu death towards the end of a seasonal coronavirus. There's no basis for it. And that's the discussion we should be having, is why are they having lockdown and quarantine when there's no reason for it? And push back, because I would now be saying for peaceful civil disobedience now, because it's gone too far. We have to end it by Christmas. And the solutions that they're bringing in of PCR testing and vaccines are entirely unnecessary, a waste of citizens' money and causing fear.
And I actually read a paper yesterday, or it was a thread yesterday on Twitter, and it was a doctor who'd been nominated, an Italian doctor in 2018 for a Nobel Prize. And he was saying, not only is it about the high false positives from running the test too high with asymptomatic people, it was actually meant to have been 3 particular, I don't know what they are, DNA particles that actually had to be present. And they decided in April to change it to 1. So if only 1 of those was present and you ran it at a high enough cycle, you would get a positive. But if you have someone, so let me just ask you this.
No, but can I just say, can we go back to the fundamentals, right?
Yeah.
It would be like if you have a disease, pneumonia, right? Or chickenpox or whatever, okay? So people are naturally immune. Those who are elderly, as we knew from January and previous times, if they had been given the information from the media, the politicians, the health system, to boost their own immune system, right? With vitamins D, C, and zinc, they've been Nobel Prize winning, that therefore no one, I would say every single so-called COVID-19 death is preventable. Therefore, we should say, no, the declaration was incorrect, and just stop talking. There is no need to test anyone, because that's invasive. You know, the PCR test, it's unnecessary. It's causing fear. So we should stop testing and stop every aspect of the lockdown. And I would say people just, you know, take off the masks, and doctors stop PCR testing. This is last year's flu, which is 100% preventable, but it's gone. And why it's gone is that the virus, when it circulates in March or April, actually weakens every time it replicates in people. And if there's a mutation in part of the virus that's required for replication, that virus in that person can't really spread anymore. And that's why when you see the 3-pronged graph presented by the director of the CDC to the Trump administration, there is a precipitous drop, okay? And that is because in individuals, the virus weakens. And then because it's seasonal, if there's a high temperature, the virus can't replicate anymore in sunshine. So therefore, as in every other year with coronaviruses do not cause any illness or symptoms after April. So therefore, we should not be talking about this anymore. And whatever the symptoms are that are being called COVID-19, probably there's a different causative agent now, and that the doctors are putting COVID-19 when it could be a death now in the next flu season of rhinoviruses or this year's influenza virus, right?
Okay, so I want to just share the expression that to me seems to be a contradiction in terms, which is asymptomatic transmission. Is it possible for someone who has absolutely no symptoms to be infectious with this?
No, and that is not, I mean, the thing is, these coronaviruses are highly infectious. We say they go around the world, you know, December, January, February, March, April, okay? So it could be that if you get the virus and it starts replicating in your body and then you sneeze, right? You know, there may be an hour or 2 or 3 between when you get the virus, it replicates, but generally you will get the symptoms as soon as you become infectious. So I would say, and I've heard other immunologists, I would say there is no such thing as asymptomatic, but also after April, coronaviruses don't cause illness and symptoms because they weaken and they become endemic viruses, right? You know, they're because we had, we'll say, influenza B in December 2019, influenza A in January, you know, 2020, and then you have coronaviruses. We don't go around PCR testing for last year's, you know, the influenza virus, because people have all been exposed around the world. If you're still alive, you're immune, and that's last year's flu. You've recovered, you're immune, you know?
And what's happened to flu this year? Because even by the WHO analysis, it seems to be down by, is it 95% or 98%?
So of course the prediction is that, you know, and it's known all around the world that whenever the people come with influenza-like illness, that as of now, they will be deemed to have COVID-19 disease when they have the symptoms of the common flu. But I would say probably symptoms of breathlessness may not be here with other flus, because that seems to be unusual. But I mean, we are doing an autopsy today, you know, in a hospital in Dublin around a COVID-19 death to find the underlying cause, you know, and that will be sent to labs around the world, because we need to know what the doctors are putting COVID-19 on the death certificates. And no autopsies are being done. And we've actually I've spent about 10 days around the world looking for pathologists to come in and do it. And there was great reluctance from the worldwide pathologists, because we need, everyone who dies of COVID-19 needs to have an autopsy to find out whether it's true or not, because this coronavirus is not as lethal. So there is no need to have guidelines to, you know, not do autopsies. I think, in fact, it's actually a way of not finding out what the underlying causative agent is.
Well, I think it was the head of the Bulgarian Pathology Association. You know, he wrote a paper and he said, I mean, he had done autopsies, and he, you know, he was like that. He said, you know, actually the recommendation of the WHO had been to not do autopsies, which to me, you know, I'm not a scientist, I'm not a doctor, but I would think surely that's one of the best ways to find out about a new or novel disease is to do autopsies, to find out more about it.
Exactly. So I think what's important is that Public Health England on the 16th of March published that this virus was not highly infectious, okay? Before any lockdown, really, in Ireland, you know, just after the declaration. So therefore, a lot of the guidelines on lockdown and quarantining are based on that this is a killer. But of course, people like me knew the coronaviruses don't kill very much. So the first SARS, on average in the world, was a chance of dying of 1 in 1.8 million. Sorry, 1 in 8 million. And when they called the pandemic on the 11th of March, it was 4,000 people out of 700 million people in the world. So the chance of dying was 1 in 8 million. Your chance of dying of cancer is 1 in 3. Your chance of dying of cardiovascular disease is 1 in 3. So around the world, it was 56 people a day were dying of this COVID-19 up until the declaration. But every day in 2020, 3,000 people were dying of the infectious disease TB, 50 or 60 more times, and no pandemic, no, you know, for another infectious disease. Yeah. So we really have to go back and say there was no basis for calling the lockdown. They had in England already reduced it to not a highly infectious disease.
Yes, and that was done before they locked down.
Exactly, but that means you can do autopsies, right? If it's not infectious, there's no need for the lockdown. If 50 times more people are dying from TB every day in the world in 2020, this is WHO CDC figures, then there's no need for the lockdown. And then we have to say, so I'm saying to people, take off the glasses of COVID-19, really, right? There was never a need for the lockdown. What is going on with our politicians in Ireland? Why are they saying we can only travel 5 kilometers? You know, for last year's flu, which doesn't cause illness after May, for which there are vitamin D, C, zinc, and other ones like hydroxychloroquine and zinc. So why are they curtailing our freedoms? Why are they not providing cancer treatment and cardiovascular and suicide, mental health? Because the politicians and the doctors every day now can see how many people are in the hospital, how many people are in ICU. And I have figures from the end of July, from January in Ireland to the end of July 2020, that we have had less deaths in Ireland in total in those 7 months than any year of the last 10 years. And so there is misreporting, because the government are reporting to the Our World in Data around 1,900 COVID-19 deaths. But if that was the case, we should have more. We should have like almost 2,000 more deaths, but there isn't. So that's why, as you may know, I've been serving notice of liability on the coroners and with a group of people in Ireland, because it's actually a crime, you know, to misreport, for doctors to put COVID-19 on deaths when it's not true, or only COVID-19 if someone died of cancer. And the coroners, you know, if they are agreeing with COVID-19 deaths without doing autopsies, it's incorrect. And the ministers and the Irish government and the Central Statistics Office and the Register's Office of Deaths and Births are falsely reporting COVID-19 deaths to the international organizations. And they're undermining, you know, the healthcare system and the political system and our trust in the media, because no one is asking questions.
So what would, oh, Ivor, go.
Oh, I was just going to say, yeah, no, thanks, Dolores. I stay out of the medications, treatments and all that. It's not in my bailiwick. But just in terms of data, I might just share for just one moment, just
Sure.
Again, being conscious there's business people here. So they're probably wondering about the catastrophic level 5 lockdown. So can you see this here? Yeah.
Yeah.
Yeah. So here's the positivity rate, and it's pretty up to date from the Irish database, straight from a government source. And we can just see here, and I said this at the time, I was literally blown away when they did the level 5 lockdown.
Yeah.
And essentially, I'll just have to get an index. Zoom is a nuisance for this. There. So there's 17th October, the curl over in the case positivity, right? So there you go. That's PCR. It's highly flawed, obviously, but still, this is the curve. And here's for the level 5 they brought in after that would have impacted the curve. Not only was it way too late, but it didn't change the shape of the curve in the slightest. It's essentially mathematically proven useless, the level 5, meaningless. And if you look at hospitalization cases, right, curled over, 21st October, and here's where level 5 impact would have started because of lag. Didn't change the curve at all. Like, this is established, and you see Neffet and everyone on television saying, oh, well, it's working, or oh, it's not working because you had a pint. This is fantasy. It's nonsense. And ICU confirmed cases, 29th October leveled off. And to be honest, it only had one, or let me see, it had 8 people per million people in Ireland in ICU with a positive PCR.
Crazy.
I mean, and the level 5 impact might have impacted here. Way too late, and doesn't change the curve. So just so the business people know, whatever about anything else said or claimed, the level 5 lockdown mathematically did effectively nothing, but it did do a lot to suicide, heart disease, depression, and
poverty.
Business.
Yeah.
Oh.
And maybe just to jump in there, Ivor, that's probably the next year's flu season as well. You know, there could be circulating coronaviruses. But I think maybe what's not so well known, and it's important for businesses, is that I'm president of the World Doctors Alliance. We have linking, you know, around the world Doctors for Truth in like 45 countries. We want to go around the whole, and now I'm president of the World Freedom Alliances, and we're working with like Robert Kennedy's group and Rainer Fulmick and Rocco Gelati, right? So I supported a mask case in Germany where they won about masks because they have legislation that if you're going to require someone to wear a mask. I ran a biosafety lab, and the person who did it, Manuel During, ran a uranium, facility, right, on nuclear reactors. If you're requiring someone to wear a mask for their work, you have to tell them you can wear it for 2 hours, you need a half an hour break, 3 times in a day, and you can only wear a mask 3 days in a row. So where the businesses need to push back is that we won a precedent's case that if you require your employees, or a principal requires children, that they will actually suffer permanent brain damage, which we have shown after 2 hours. And we took cases against the German train company and Deutsche Bank, which the precedence case was one. It was a minor case to show that if you're on a train or in school, someone has to give you guidelines that you shouldn't wear this for 40 hours a week, but that you can then claim off their insurance. So employers requiring employees to wear masks can claim off their employees, or the students can claim. And we are starting the process of claiming. And that statement got 13 million downloads in 6 hours and 1.1 billion downloads in 5 days, okay? So if I was an employer, or we are now, because I've been doing this notice of liability, because I asked the families as well to contact me with COVID-19 deaths, for the families to ask the doctor and the doctor's insurance, what treatments did the patients get? Because if the doctors did not give the patients the right treatments, and the doctors with COVID-19, the doctors and their insurance are liable. So we were able to actually affect the business by writing to the CEOs, okay? And what we don't want, and to the coroners, right? Because if it's a suspicious death, because doctors are required to give patients full information of treatment. And if the patients die of COVID-19 and they don't get the right treatment, the doctors are liable, the coroners are liable. Now, I'm not about suing doctors. I'm about changing behavior, because the lockdown does not work unless we have huge deaths, right? You know, the government needs huge deaths of COVID-19 around the world. And that only works if doctors write COVID-19 down on the death certs, and people only die of the disease COVID-19 if they don't get prevention and treatment in a timely manner. But if the doctor, so at the minute, it's more comfortable in a way for doctors and principals to force, either not give treatment or have people wearing masks. But if suddenly the individual teachers and principals are liable for causing permanent brain damage for the students, which they are, or doctors may not have given the right treatments, and they and their insurance are personally liable, that is how you change behavior. And in Germany now, the unions of teachers are now pushing back on the government, and the teachers are saying, we're not enforcing masks anymore because we as individual teachers are personally liable and can be sued by the students in the universities or by their families, So we're trying to end the lockdown, because the harm of the masks is causing more harm than good psychologically, and in suicide and in reduced oxygen. And doctors not giving patients the correct prevention and treatment is causing unnecessary suffering and death.
Thank you, Dolores. And I have to say, from a personal point of view, my 14-year-old, I have 2 boys, and the older one is now being homeschooled because of the masks.
My daughter as well, yeah.
He simply could not breathe. And people go, oh, it's for the greater good. Oh, just put it on. Just, it's just a mask. Wait, the hashtag is wear the damn mask. And there have been some, I saw a couple of videos where they were doctors in scrubs, hooked up to oxygen monitors, wearing a mask, and very calmly claiming that it does not affect your oxygen levels. And I can't understand that, because I know personally I can't breathe with them, and it doesn't matter which one it is.
So the thing is, the test that we did, or that the health and safety people in Germany did, it's around, you blink to look at your level of cognition, right? As if you were operating machinery, if you were working in a uranium facility, if you were driving a car. And they clearly showed that with the mask on, and they had them on the Deutsche Bahn, that you couldn't actually focus enough after, say, 2 hours, and you were getting permanent brain damage. You couldn't. And of course, there is no way pilots or people in cars should be wearing masks. So under health and safety, there is
driving around by themselves with a mask on, because they're so terrified. They've been absolutely terrified with this idea of asymptomatic
But in Germany,
transmission.
you're legally responsible. So there are actually health and safety guidelines. So the government was saying you have to wear masks all the time, or the train was saying you have to wear masks on a 5-hour journey. And that is actually against the health and safety for masks. You have to be given a time period, a rest period, and if you don't, that is unlawful. Now, that was a small case in Dusseldorf, but it actually was a precedence case, even though a lot of people are ignoring it. Like the police are going around on trains with guns asking for exemptions. And they actually, I know someone where they took the exemption letter, off the original, And then the police at the next stop got on and kicked them off the train for not having an exemption letter. So, and we were in Frankfurt Airport actually with Martin, told to be sitting, 15 feet apart in the airport, which is crazy, with my police looking at exemption letters with guns. And then you get on the plane and you're all sitting beside each other.
We haven't got to Martin yet, and we've got 25 minutes left of this webinar because I think
so I might have to go to another meeting. If that's okay, I might shoot.
Dolores, absolutely. Thank you so much for your amazing work. Real COVID hero, like the rest of the panel, and
thank you.
And so many others. So
thank you very much. Lovely. And to Ivor and everyone on board, thank you very much.
Look, Dolores.
Take care.
Dolores. Take care. Bye-bye.
So we'll go. So I think on the subject of masks, Martin, you are on this case in terms of masks in schools and everything else. So Martin, why don't you introduce yourself and your background? Because again, just another amazing.
I'll keep it as brief, and people can ask me some questions. It's a pleasure to join you all here. So hello to everyone. Hello to Ivor and Pat and yourself, Sarah, and Dolores. I think she's just disappeared there, but hello anyway. But I can speak from a legal perspective, of course, and a business perspective. I'll explain that in a moment. But it's also very important that I should address the issue of information and suppression and these so-called fact checkers and so forth. I'll come back to that in a few minutes. And of course, as you pointed out, the mask issue, it's of serious and urgent concern, especially for our children. I was in Copenhagen at the weekend, and I had a wonderful opportunity to interview the Belgian doctors, Docs for Open Debate. They're the doctors behind the letter to the Belgian government in and around the beginning of September. And I believe 650 doctors from Belgium wrote this open letter to their government, together with, I think, 2,500 healthcare professionals as well. So it was a wonderful opportunity to speak to them in relation to the mask issue in respect of children at school. And joining us in that interview was Harley Street neurologist, Dr. Margrethe Gries-Brazon. She's German, and she had a great input into that conversation as well. So just before I go ahead, I just want to give you a bit of background about myself. And I should say at the outset, I'm speaking on my own behalf, and just to make it clear, I'm not speaking on behalf of the Bar of Ireland, and any views that I express are my own and not those of the Bar. And none of what I say constitutes legal advice. Or certainly medical advice, as Ivor said so nicely, that's not within my bailiwick. And so if anyone out there, any of the viewers have any specific legal concerns, my advice would be to consult with a solicitor and seek independent legal advice in relation to your own particular circumstances. So what I'm saying here now is a general overview of the legal issues or the subject matter at hand. I'm a practicing barrister, and I'm also an advocate for human rights and qualified in human rights law. And this particular qualification or interest that I have has been rekindled greatly in light of the current circumstances, which are, in my humble opinion, appalling. It's alarming. And I practice in civil litigation. I've also done a lot of personal injuries actions. So I have a great focus. It's always in the forefront of my mind, liability. What are the liability issues? And I can see obvious and clear liability issues in relation to imposing masks on individuals, especially in light of the body of evidence that's available. So I'll come back to that in a moment. Also, I'm also the legal counsel for the World Doctors Alliance and newly appointed legal counsel for the World Freedom Alliance, which are independent non-profit organizations. And I'm in regular contact with lawyers and experts all around the world. Regularly meet and liaise online with lawyers and those professionals on all continents. And so there's great concern right across the world with so many professionals coming out and speaking out about what is actually happening and the devastation and destruction that has been imposed and rolled out on our societies. So, and that's alarming. I come from a business background as well. I have more than 20 years experience in business in the manufacturing and engineering industry here in Ireland. I was the production and quality assurance manager in Castleblaney Steel Products, and I ran production in that factory before it succumbed to the financial crash back in 2008, caused by our good friends in the banking system. And so as a former production manager and director at one stage of that company, which was in effect Ireland's most successful and long established steel furniture factory, I can say, in light of my experience, business experience, I'm not impressed in the slightest at the way the government has handled this crisis. I think that the alleged cure is far worse than the disease that they're seeking to treat. And I applaud the tremendous work that Ivor Cummins has done. It's absolutely remarkable, and it's shameful. It's shameful on the government that they're not listening to the facts, and we all know it's common sense. Facts speak for themselves, and the way that Ivor presents it is truly remarkable. So that should be right out there in the forefront of public debate, robust public debate. And the question is, why not? And that's what has alarmed me. In fact, that's what brought me into this entire issue, and what I suppose woke me up to the need to speak out. And because back at the start of this year, I noticed censorship on YouTube, and I've never encountered that before. I noticed a very famous American human rights lawyer, Professor Francis Boyle. He's actually professor of international law in the University of Illinois. And I shared, out of interest and out of curiosity, I shared an interview that he did back at the beginning of the year with a number of my colleagues. And Professor Francis Boyle is quite famous because he was instrumental in drafting, I believe, I could have the title wrong, but I believe it's the Anti-Bioweapons Warfare Act of the United States, 1989. Now, I'm open to correction on that, but it's words to that effect. And so he was speaking with some authority on the subject matter, which was SARS-CoV-2, which we all know is the name of the novel coronavirus, which allegedly causes the disease known as COVID-19. So a number of weeks went by, and I asked my colleagues, what did you think of this Professor Francis Boyle? And they said, well, we didn't see the video, Martin. It's no longer there, or we can't access it. So I checked it out, and I noticed that the video had been deleted. And that was strange. But I noticed a number of weeks afterwards, and over the course of the interim period between then and now, there's been just scandalous censorship and suppression of anything, apparently, that seeks to challenge or question the official narrative. And that's so wrong. It's actually, people don't know this. That's a direct breach of our fundamental right to freedom of expression. Under Article 10 of the European Convention on Human Rights, and under Article 40.6.1 of the Irish Constitution, we have a right to freedom of expression. And that right it consists of two parts. It consists of the right to impart information, like YouTubers and doctors and scientists have been doing and attempting to do, but it also consists of the right to receive information. So people don't realize that, but that's a fact. It's like a bird with two wings, and we all know that a bird never flew on one wing. But when governments, big tech, the media seek to suppress alternative views, which is, I spoke to a solicitor friend of mine in England the other evening, and he mentioned the fact that Ofcom seek to impose restrictions on anything that challenges the official narrative. Why? Why? If their position is so strong, why don't they just open this up to open debate, robust open debate? What are they afraid of? That raises more questions than it does provide answers, and that's very concerning.
And unfortunately, Martin, just to sort of reiterate that, and really the impact of this censorship is that people then start to get just one side of this story, and because this is business people, you know, they've been told, you know, by government, and then they hear it on mainstream media, you know, these leaks that come out, and this is what, and they don't even know where they're at, and these levels and everything else. And they're following those orders. They're following that because they think that this is what they have to do to save lives.
They're afraid,
They're very
Exactly so.
afraid, and really for me it is about flattening the curve, flattening the fear. Sorry, not the curve. Sorry, Ivor. Go.
Oh yeah, now
I-
just
yeah.
a quick point there. Hi, Martin.
Hi,
Thanks
Ivor.
for
How
your
are you?
kind words. But yeah, on this, the censorship is extraordinary, and I was shocked when it started. And the CEO of YouTube said, if you say anything against the narrative from the WHO, you'll be taken down. And in one fell swoop, an undemocratic, unelected, effectively private corporation, highly linked to industries with massive conflicts in this matter, were declared to be the world only person allowed to speak. That was stunning to me at the time. And Professor Carol Sikora, oncologist, multiple PhDs in England, did an interview with Unheard, and they were just but YouTube took it down. And he's extremely careful in what he said. He just talked about prior immunity, and they took it down. So this is nothing to do with protecting the people. I mean, clearly, and well, just from my own perspective, I was...
Carl Hennigan had the article that he wrote about the Danish mask study was deemed to be factually incorrect on Facebook.
Yeah,
Professor Carl Hennigan of evidence-based medicine in Oxford University is now deemed to be spreading misinformation and disinformation.
That is it. But fact checkers are funded by certain corporations and corporate type interests. So clearly they're completely biased, which is shocking. Censorship from industry in a sense. But as an entrepreneur in UCD tried to set up a debate with me and one of the Irish professors who's been coming out with like 30,000 people will die, hide under your bed. And he actually agreed to it by email. And then they began to organize it with an Irish media company. We might do it out in UCD in the hall. And when it got pretty official, the guy backed out. Now, I won't say his name, but he's since been interviewed by the media company and another one of those guys. There's around 6 of them, misinformation merchants. And they came up in their interview with just babble about R numbers and imperial modeling, just junk science. That's all they can do. And they won't debate because they know they'll be eviscerated. And I'm not being arrogant, but they've seen this. They know.
As I said, I think my 14-year-old could beat in a discussion because you know him and I have these talks and you know to be able to understand what's really going on and he you know sorry master. Thanks,
sorry,
there's an old saying in the land of the blind, the one-eyed man is king. And they are the one-eyed man, you know, because they're in control. They can switch off the alternative voices and people who want to speak out. In fact, I just wanted to say as well, Dr. Pat Morrissey, I commend you, Dr. Morrissey, for your courage and integrity in speaking out to help people. In your opinion, there should be a mechanism in place to facilitate doctors who are genuinely concerned, not to shut them up, not to attack them like Dr. Morrissey and Dr. McFeely and Dr. Marcus de Bruin. It's appalling. I've spoken, I've traveled across Europe and I've spoken to many doctors across Europe, and you're not alone. And I know, thank God, I've seen some more doctors speaking out here in Ireland, and the more the better, because this entire subject needs to be opened up to public debate, because there are huge liability issues, left, right, and center. Now, of course, I don't know if I've got time to address all of the legal issues, and I'm happy to do another interview at a later date to address those in more detail, to give them the time that they warrant, I suppose. But I just wanted to say, you know, we all know, we were told at the start that this was just to flatten the curve. We weren't told that this was going to flatten our economy, destroy businesses, destroy livelihoods, destroy the society. And that's what's happening. I can say that speaking from my business experience. I saw what happened when those at the top turned off the credit tap back in the banking crisis, and how that affected the business that I had grown up into and was a part of for decades. And to see all of the lives that were destroyed at that particular time, not just in that business, but in so many other businesses across Ireland. What we're seeing now, what I'm witnessing now from my own personal experience back then, is a repeat of that on steroids. This is appalling. It's absolutely, I have people coming to me in my practice as a barrister, parents, they're at their wits' end because of the issue of children being forced to wear masks, and employees contacting me in relation to being compelled to wear masks at work. Now, I would speak to the business people just in relation to the business aspect. Of course, it's a remarkable situation that we're in, and businesses are obliged to comply with their legal obligations. You know, and in the current crisis, we have the work safety protocol that was produced by the government back at the beginning of the year, and it's actually just been amended at the beginning of this month. So employers or business owners are obliged to comply with requirements under that, and of course under health and safety legislation. The name of the act is the Safety, Health and Welfare at Work Act 2005. So businesses and business owners and employers have legal obligations to provide a safe place of work, a safe place of work, and so on. But if an employee, for example, has an exemption in respect of a mask, I know I'm just scanning over this very quickly because I know we're tight on time. They need to respect that, because if they don't respect that, they're exposed to breaching their legal obligations under the employment equality legislation. And if a business throws somebody out of a shop, for example, or a business premises, you know, if they're not wearing a mask, that business is exposed to liability or you know, for breach of equal status legislation, and been found culpable or liable for discrimination. And if a person is thrown out of a shop, I need to warn businesses out there that if a person is thrown out of a shop where they, in circumstances wherein they've got a reasonable excuse for not wearing a face covering or mask, then your business is exposed to potentially up to €15,000 of an award made by an adjudicator in the WRC. So if I, as a business manager in my past, was aware that the people in my charge were throwing people out of my premises without having regard to other legal requirements, then I would be extremely concerned. So people need to educate themselves, or business owners need to educate themselves in what their rights are and what their obligations are, and what their customers' rights are as well. So this applies not just to customers in a shop, it also applies to people who are seeking to avail of business services. Now, going back to the school issue, the school issue raises, with masks, forcing children to wear masks. There's no basis in law for that. There's none. That is a guideline from the Department of Education and Skills. And the wording, I'm open to correction on this, of course, but from memory, the wording is all students should be asked to wear masks. Should be asked. And I'm hearing it on practically a daily basis that children are being thrown out of school because they're not wearing a mask. Now, there's no legal basis for it, but what there is a legal basis for is under occupiers' liability legislation. If somebody gets injured on your premises because of the state of the premises, and there is an argument to say that forcing people to wear a mask on your premises may constitute the state of the business. Now, that's open to question and further research. But the school has a duty of care to the safety of those students. Duty of care, well recognized in our legal system. Now, that's a lawful requirement. And if the school seeks to impose a mask on a child, and that child feels faint and falls over and bangs their head on a desk or a sharp object, and God forbid is hospitalized or worse, then there's a possibility that school could be held liable. A high probability the school could be held liable for negligence in that instance. Now, if a school is put on notice of that, first of all, of their duty of care, which they are obliged to know anyway, put on notice of that, put on notice of the fact that compelling children to wear masks has no legal basis, and put on notice of the fact that the overwhelming body of evidence suggests that masks can cause harm. I've heard it firsthand from a Harley Street neurologist. She calls this child abuse. I asked her, and I asked the Belgian doctors, does this constitute child abuse? And they said yes, resoundingly so. So that's an issue that needs to be highlighted. It needs to be I'm not saying that that's correct. I'm saying that this needs to be the subject of public debate now, not next week. If our children, we have an obligation as a society to protect our children, and that should be front and center of robust public debate now, not as soon as possible, not in a month's time. Sorry.
And just one thing, Martin, there's no question, but there's 40 years of science on the ineffectiveness of masks. Now, if you want to wear one, fair enough, but to bring them in the summer and mask the children, there's also many, many studies showing that children are extremely minor vectors for this. And we also have the fact that we're in a winter resurgence of effectively last year's flu. If you put all that together, there is zero justification for mandating. Even advising it, to be honest, I'd say is precarious for children.
It is, in my opinion, legally it is. It's highly questionable and potentially could lead to liability.
And the bottom line is peer-reviewed papers have shown that asymptomatic and pre-symptomatic transmission is not a thing. Therefore, masks are not even, like, what are we doing it for? You know, the whole point was you didn't know who had it, and if you had it, and you were masking for somebody else, and you were protecting other people. And the reality is, being harmed by wearing something, how does that help anybody else at the end of the day? You know,
well, the Danmarks paper that just came out the other day, you know, that's resounding evidence that, you know, of the inefficacy of masks in protecting. So, but it's clear, the evidence is clear on the other hand, that masks can cause harm. And can cause harm. Well, obviously, I mean, you know, you put a mask on, you're depriving yourself of oxygen. That's just common sense.
And,
you know,
and the argument against mask would be, oh, it stops you spreading to others, maybe not so much yourself. And they were very clever to preempt this by saying that way at the start, because they knew if you did a trial on it, you're not going to see any effect, because we have 40 years of science on this. So the one that's hard to disprove is that it may protect someone else. But the reality is, you know, the science is almost certain.
If you're not sick, if you're not harming, you're not a risk to someone else. We've actually, it's 4 minutes to 2. We were meant to have done 30 minutes of Q&A, but we went over because you all have so much, really, you all need a whole day each, I think, to actually share your knowledge and to be able to give the information to people that is really not easily accessible. We have a whole load of questions.
Make sure people are aware of Ivor's channel on YouTube, because it's a treasure trove of information.
Absolutely. And I love the title, The Fat Emperor. So there's loads of incredible.
I'm not censored yet, which is incredible, but I think it's because I always quote references, government sources, and only talk data. I don't talk hydrochloroquine, I don't talk medications or anything medical, but that's probably it. But the other thing is the questions and answers. I mean, I can run over a bit now. I'm sure many people can, but the other thing is you could do a separate Q&A dedicated to Q&A.
Pat, you have a busy practice. I don't know if you can hang on a little bit.
I can hang on for a little while. Yeah, if the sentence directed specifically to me, I can hang on for a little while.
So for those who've had to leave the call at 2 o'clock, I know that this was meant to be a lunchtime webinar, and we did that so that people could have a sandwich and have a listen to something new. That would be amazing. If we can stay on a little bit longer to do Q&As, that's amazing. Anyone who has to go, that's great. So let's have a look at some of these questions. So, oh goodness me.
We can do rapid fire answers, just a bullet answer.
Yeah, so if you crash while wearing a mask, will your car insurance pay out? That's probably for Martin. Do you know the answer to that?
Well, I've never been asked that one before, but yeah, it's questionable. I'd need to look into that fully, but yeah, if you're, could it be analogous to drinking while driving?
Well, I did actually hear from somebody that she rang her daughter's car insurance and asked this question, and they said no, especially if you wear glasses to drive, because your glasses.
If I put on a mask, my glasses are going to fog up. You know, that's.
Okay, some of these are quite long, and I think we're not going to be able to get through. So what I might do is actually post these out to you guys, and if there's anything you can do just as a quick kind of one line, that'd be great. A lot of people are asking about NFET, and is there any, why do they, why are they not listening? But I don't suppose, but Pat, do you want to take that?
Well, I suppose I did answer in the chat there to someone. Basically, I think that they've become a prisoner to past decisions that that, and I used the analogy on a webinar or podcast the other night. It's like they're driving a bus down a narrow country lane, and the lane is called lockdown. And they realize that it's getting increasingly difficult to make progress, and they can't really get to go where they want to go. And they can't really get the bus into reverse either. And they're beginning to feel a bit stupid. And I think that's where we're at the moment, you know. They're prisoners of their past decisions. And they're guilty of the sin of pride as well, if I want to bring religion and God into it, because they don't have the humility to acknowledge the evolving evidence and the evidence that people like Ivor are putting in front of them the whole time. So it's a lack of humility, a lack of maturity, a lack of reflection, and a lack of consideration for the people of Ireland. And I'm probably going out on a bit of a limb saying that, but that's the way I see it.
Well, I think from the people of Ireland's point of view, that is exactly what it feels like.
At this stage, I showed the mathematical essentially proof of level 5, and they still claimed that level 5 worked. So there's no way they don't know. They're not stupid. So I would agree there's an element of painting into a corner. They're trapped now in a bizarre narrative, and they're going to go through it to the death. That's my perception. Huge cost to the country.
Here's a question for you, Ivor. Someone's saying here that a lot of people say you cherry pick information.
No.
What do they mean by that, as that person has not seen a proper counter argument yet? And what about New Zealand and Australia? Any thoughts?
Okay, very briefly, we'll take Japan as an example. So Japan is seen as a success somehow for lockdowns they didn't do and masks that they often didn't wear, right? Japan, a cluster of people in a study right through their rise in PCR positive. They got a couple of hundred people and test them for antibody every 2 weeks, exactly what an engineer would have done. That group of people went up to nearly 50% antibody positive, and then they trailed off because we naturally dump antibodies and keep the T-cell memory. That showed that Japan got a ton of spread. It just didn't get the death and the impacts, and that's to do with population health we mentioned earlier. So that's just an example. The other thing about New Zealand is they banned antibody testing coming into the country, right, back in February or March. Now, why would you do that? And there's a very strong possibility that there was a dormant or a ripple effect in October, November with all the flights from China, and they could have built up a degree of community immunity during their late summer, right? So that's only hypothetical, but there's many such examples of why New Zealand may have the performance it had. And the people who say cherry picking, they're cherry picking 1 or 2 countries out of 200. If 198 in 22 studies show lockdown doesn't work, and you want to keep picking the 1 or 2 that sort of maybe indicate it does, right? They're the cherry pickers.
And we don't know all the factors in New Zealand either in terms of, even with their PCR tests, what was their cycle threshold? Did they have them very low so they were not getting as many false positives and things like that? You know, were they only testing symptomatic people?
The fact that they banned the import of antibody tests right at the start, go figure, right? I mean, you couldn't make that up, but apparently it's true.
It's quite shocking. It is quite shocking, the stuff that we're hearing. So I think we'll just do a very quick roundup, just as sort of some final words of advice that you would have for those business people out there who are also parents as well, and they've got parents in, you know, potentially in nursing homes. And there was one question which was very much about, you know, what if there was a pushback if they tried to lock down again in January, which there is obviously talk already that they're already setting up for a third wave. You know, and according to Dr. Mike Eden, you know, viruses don't do waves. So we didn't even have a first one. It just virus did what a virus did. So the second and third wave, which has never been anywhere, even the Spanish flu is debatable whether that was even the second wave.
It's clear that it's a wave of cases, not a wave of the virus.
Pandemics. Yeah, pandemics, absolutely. So in terms of going forward from this point, you know, next week we're meant to be opening up. We hear again that there's I don't know if this is now true, that these horrible expressions that have come out, wet pubs, those that are not serving foods, you know, will not be allowed to open again. Again, no evidence. I mean, Carl Hennigan showed in the UK that pubs were not spreading anything, and there was no evidence, from that. He did a great paper on that. So, what would be your advice? So, Ivor, we'll start with you.
Right. So the lockdowns have been de facto or essentially proven to have minimal effect on mortality, which is what matters. You could use them in extreme situations, in extremis, with overloaded hospitals and exhausted health workers, maybe. But a real epidemic, as we've seen, has a near vertical rise in ICU and mortality, and then curls over in Northern Europe in Gompertz. A fake epidemic has a near horizontal slow rise coming into the winter. That's a winter resurgence. If you become hopelessly overloaded, you have time to do extreme measures. These people want to do extreme measures with no extreme circumstance present, clear to anyone with eyes. So I would say start rising up and questioning. And that doctors group has a white paper at covidrecovery.ie, I think. And you can download it there, and it's readable by lay people. And every business person in Ireland should read that paper 3 times and then walk out their door and start asking questions.
Yeah.
Thank you, Ivor. Thank you so much. Pat, over to you.
So we don't know exactly what's happening next week, as far as I know, but we know that society is going to open up to some extent. And we're in... even though I'm with you guys here, we can become trapped in echo chambers. We need to use the time that we have with the reduced restrictions to talk to as many people, to convince as many people as possible, so that we can push back against this autocratic takeover.
Time really is of the essence. Yeah.
And again, thanks, Pat, because your courage in speaking up, when so many of your colleagues, were quiet, is remarkable. It really is.
Absolutely.
And, I heard you speak at the protest, and, with Marcus de Bruin as well, and Dr. Feely, the backlash against you was horrific, and I'm sure many people were afraid of that. But I think we should be more afraid of not speaking up now. We should be.
I think they shouldn't be questioning Pat. The question is not why did Pat speak out. The question is why are they staying silent?
Oh, absolutely. Yeah. No, absolutely.
I will just say, can I say one quick thing on that? A few doctors I'm connected to, and also I've got inside knowledge of ICUs and all. And again, this thing has been a farce. But a few doctors who know this have spent up to 30 minutes with other doctors going through, for instance, my data until their eyes unglaze. And they say, I never thought of it like that. So there is a big problem with sheer indoctrination. A sheer propaganda for 8 months has made the brains of people, including doctors, quite sick, actually. It's psychological disease. And this has been studied in the past. So we have a big job ahead of us. But that job's got to be done, or the future is thrown under the bus. I have 5 children. This thing is going to bad places. And that is not conspiracy theory. Anyone who looks around and knows the data.
You're in good company, Ivor, with that. I want to read a quote from one of the people that encouraged me to speak out was Lord Jonathan Sumption, when he said back in March in a BBC radio interview, he called this a hysterical slide into a police state. And the greatest attack on civil liberties in human history, or words to that effect. Now, I know from being in front of court judges on a regular basis, judges are very measured in their language. They're very conservative in their speech. And when you hear a former Supreme Court Justice of the UK Supreme Court using language like a hysterical slide into a police state, you better sit up and pay attention. It certainly grabbed my attention, and he hasn't stopped. His lecture to Cambridge University last month said that the British public are unaware or don't care about what's happening, and won't care until it's too late. What's happening is, dare I say, does not seem to be about a virus. It seems to be about something else. And perhaps people could look into the Great Reset and so forth, and just look, because as Robert F. Kennedy said that to us the other night in our conference call with him in Copenhagen. A lawyer will look at something and always ask, cui bono, who benefits? And of course, the big pharma will benefit and so on and so forth. But there are big tech will benefit from all the contact tracing.
We've had the greatest wealth transfer ever of around 200 billion, I think it is, into those high-tech companies. Certain big corporations have already, I mean, who were not going to suffer in this anyway. They've already increased their wealth by about 200 billion. And where did that come from? The small businesses all over the world.
Businesses that are being decimated right, left, and centre. Every one of us can speak about businesses that won't open their doors
again. We've just
again.
got some polls there that have come up, and I can see already, you know, how much impact financially this has had on people, and we know that our wealth is absolutely connected to our health. You know, this is insane to just think, oh, it's all about, you know, being safe from this virus. We have to take the bird's eye view. We have to get some perspective. And we have to get some context in terms of the information that is being disseminated, you know, across the media. Sorry, the polls keep coming up in my face, so I'm blocking that.
Okay, well, there are legal challenges.
Yeah, and who benefits is a great question, and that's what investigative reporters used to ask 30 years ago. I'll tell you with certainty that if you took investigative reporters like Watergate and all those kind of things and brought them in a time machine to today, within days they'd be called conspiracy theorists. So what we once respected and was crucial for human freedoms, investigative reporting, digging, looking at conflicts, now that's conspiracy theory. And the reality is, back in March, I knew something was wrong from my analytical brain. I'm 30 years problem solving, right? I pattern match. And everyone was talking about no new normal or no old normal. We'll have a new normal. And I couldn't understand it. And also corporate people I'm connected to said, we've been told no one's coming back in the office till 21. And I said, but how can they know that? Because we know the Gumperts, we've seen Italy, we've seen Diamond Princess. I mean, I just couldn't understand it. But then, I understood it later.
It's out in the open. It's out in the open. It's only a conspiracy theory if you're against it. If you're for it, it's a great plan.
I keep saying.
And the World Economic Forum, the WE Forum or whatever.org, they've been publicly saying what they're doing for years. And since March, they've been on overdrive. It's only a conspiracy if it's hidden. If they don't tell you what they're doing.
If you can't prove it, it's only a theory. It's just something you have an idea about, you know. So if you're even a conspiracy theorist, even that term is ridiculous because the meaning is now you're a tinfoil hat and you're insane. The reality is, if you're a conspiracy theorist, you're saying, hang on a minute, what's going on? Because what's happening is not making sense. So let's have a look.
For this one, the only thing you need to be a conspiracy theorist is to have a pretty good analytical brain and two eyes. That's it. And you're there. I mean, it's all there, guys. It's just.
It is. It's all there. It really is. Martin, so we're going to wrap up. So any last words from you?
Well, yeah, there is a possibility. I've seen a question there about court action. I always advise in the first instance to try and resolve, to the best of your ability, to resolve any issues that you have or grievances amicably, reasonably, and logically. Do not rush into court. It's not something that you can take or should consider doing lightheartedly. You need to consider carefully before doing so. But if warning letters and so on and so forth do not produce the desired effects, go and speak to a solicitor. You do have a right. You have a constitutional right to access to the courts. You also have a constitutional right to earn a livelihood and provide for your family. So if your business is at risk, I would suggest that you seek independent legal advice from a solicitor and consider bringing a challenge. In my opinion, the legislation, after listening to the experts and the data presented, the legislation is open to challenge, in my opinion. And I understand from speaking with colleagues here that there are certain court actions coming down the tracks. I'm not at liberty to disclose what they are at the moment, but I can say from speaking to other lawyers, colleagues across the world, there are challenges currently in being in the United Kingdom. There are 2 fabulous judicial reviews in progress over there. There's a constitutional challenge in Australia, in Victoria. There are several constitutional challenges across the United States. And in Canada, Rocco Galati is heading up the charge there in Canada. And I'm also liaising on a regular basis with a constitutional lawyer over there as well to wordsmith, as he puts it, in to create statements of claim, which can be used across jurisdictions. So there are people coming together, doctors and scientists and lawyers to share and pool resources and information. And that's continuing, and I'm delighted to see that that's happening. So people,
thanks, Martin, and we're all following as well. Rainer Fulmisch as well, and his,
of course, Rainer Fulmisch, yeah, exactly,
yeah. Test as well, which I understand was this week. I think he filed it this week with the German government. Is that right?
Not quite sure if it was that one, or I know he's bringing another challenge against Facebook for censorship. So there is fight back, pushback, and that doesn't have to just happen in one country. It can happen right across the world. And of course, we in Ireland can rely on decisions and judgments that, especially judgments that are determined or made in other common law jurisdictions like United Kingdom, Australia, United States, Canada, and so on, South Africa, but not so much so that the European decisions, although they might provide what we call persuasive authority that might guide or help a judge in making his or her determination, especially the one in Portugal recently, where the court held that the PCR tests were unreliable.
And there's another one in Italy. There's another one in Italy happening as well.
There you go, yeah.
So it's fantastic. We need to watch out for those, and we need to use those, because obviously as a way of setting these precedents, they are absolutely invaluable at the end of the day. So many people are saying thank you, they've got to go, so I suppose we better let you guys go too. Thank you so much. It's been absolutely brilliant, I have to say, because I've been following all of you, and to get to actually speak to you live like this has been amazing. I'd like to thank HFI. I volunteer my time with HFI because I believe that for such a long time there wasn't another voice. There was no one else who was actually supporting the people. They do a lot more behind the scenes than people are aware of. Really, I would encourage you in any way you can to support HFI. It is voluntary, it is apolitical, and they are all about getting our freedom back and our freedom to choose at the end of the day. If you want to wear a mask, but don't make everybody else do it. If you want to lock yourself away because you're afraid, that should be your choice too, but don't lock healthy people up and decimate businesses in the process. So my final bit of advice, I suppose, out there is, for community, I'm on the Chamber of Commerce in my own local vicinity, and it is to get businesses together. Share this video amongst all the businesses in your town. Have a conversation, open up the debate amongst yourselves. Share, your own knowledge and everything else, and look to flatten the fear, because the fear is what's keeping people, not thinking straight, as Ivor said. We're just become completely indoctrinated, and it's about really cutting through the fog, on this, and really getting some clarity, some logic, and some compassion as well for everybody who has suffered as a result of these.
I would just add there, just on the topic of fear, just a quote that one of the Belgian doctors gave in a speech to the conference in Copenhagen at the weekend. He said, "Fear knocked at the door, faith answered, and there was no one there." I thought it was beautiful.
Well, that is a brilliant note to end on. So thanks again. And I'm hoping that you'll join me again at some stage to maybe continue this conversation. We had so many great questions. I will definitely send them on to you as well. And if there's any way of answering them, we can set up a Q&A page after this as well, so people can maybe, if some of those answers would be very relevant to everybody really to understand. So I'm not going to say stay safe, because everyone knows how to stay safe and look after themselves. I'm going to say stay sane and stay strong, and we need to unite, and that's the way forward. So thank you, everyone. Absolutely awesome couple of hours almost that we've spent here today, and really, really grateful. Thank you so much.
Great stuff. Thank you, Sarah. Good luck. Bye now, guys. Bye.